Hi, I'm Dr. Koo, one of the doctors at North Texas Dental Surgery in the Dallas-Fort Worth Metroplex. Today, I'll present to you a case where we completely transformed the young man's smile by working on his upper teeth only. To give you a little background, this patient has struggled with dental problems all of his life. Over the years, most of his upper teeth have crumbled. Desperately in need of help, he found us through our favorite social media platform, YouTube, and finally pulled the trigger on getting his smile makeover done. We take a lot of pride in what we do. We pay attention to the smallest details and strive to deliver you an outcome you desire. I'll walk you through how I tackle this particular case. Warning, some of the video clips may be a little bit graphic. As you can see in this preoperative photo, most of his upper teeth are heavily decayed and only the roots remain for most of his teeth. During his prosthetic evaluation appointment, Dr. Saeed, our prosthodontist, and I determined how much bone reshaping would be appropriate based on how much of his gums show when he smiles, and also where he would like the new teeth to be. After I fully numb the patient, I peel the gums open to expose the bone surrounding the teeth. So why do I do this as a first step, instead of taking the teeth out all at once? I like to mark what I call my bone reduction line. I don't like to do things willy-nilly. Instead, I like to predetermine how much bone reduction or reshaping needs to be done and stick to that plan. I draw the line with a sterilized pencil, and then score it with a dental handpiece. Then, I thin out the bone on the facial, meaning the front surface of the jawbone, to make it easier to get all the teeth out. I try to be extremely careful when I take out teeth, because I try to preserve as much native bone as possible. This part can be sometimes quite time-consuming if the patient's jawbone is super dense. However, in this patient's case, the teeth came out relatively easily. Once all the teeth are out, I reshape the top portion of the jawbone to create a nice flat platform for future prosthetic teeth. I spend a lot of time taking care of infected areas before I move on to implant placement. I do not like to leave any residues behind because those can cause problems down the road. I use a lot of hydrogen peroxide here. Then, we move on to implant placement. When placing implants, I try my best to achieve symmetry. I often check angulations with a sterilized pencil and implant drivers to check for symmetry. I normally aim to place 6 implants per job. Why 6 implants instead of 4? Isn't this procedure commonly known as all-on-4? When I used to place only 4 per jaw, I noticed that implant failures often occurred near quote-unquote terminal or tilted back implants right by the sinus areas. It makes sense to me now as to why, because chewing forces are concentrated there. So, now I try to over-engineer the system by placing 2 pterygoid implants in the back, 1 per side. Dr. Choi and I talked about pterygoid implants in some of our previous videos, so I'll skip explaining what those are. I like to make sure my implants are sunk slightly below the level of the bone quote-unquote platform, because there will inevitably be some bone shrinkage in a few months. I try to compensate for that height loss by placing implants deep. After implants are placed, our prosthodontist Dr. Saeed and I work on selecting multi-unit abutments. They're essentially the middleman between prosthetic teeth and titanium implants. In my humble opinion, this step is the most crucial step when it comes to all-on-4 implant dentistry. There's a pin attached to every multi-unit abutment. This pin shows the path of insertion for the prosthetic teeth. The goal is to place multi-unit abutments such that those pins are as parallel to each other as possible. Parallelism among these multi-unit abutments ensures proper seating or fitting of the teeth and also minimizes mechanical complications. Makes sense, right? Also, we want to make sure we control the thickness of the prosthetic teeth by carefully positioning the multi-unit abutments. This is where a prosthodontist's expertise comes in. I've always been a big fan of prosthodontists. They go through rigorous training in handling complex dental prosthetics, such as all-on-4 teeth. I've been fortunate enough to work with 3 prosthodontists here at North Texas Dental Surgery, and they make a world of difference for me and our patients. We make sure implants are turned appropriately to make the pins as parallel as possible, and then we do our scanning. Once all the data is gathered, our design team starts working on making the upper temporary teeth, and I'll work on sewing the gums up. In this case, the buccal, or also known as facial bone, or let's call it the front surface of the jawbone, got blown out on the right side due to infections. As a result, I had to do extensive bone grafting to reconstruct the area. Knowing that there's always some bone shrinkage after any type of bone grafting, I packed a lot of bone. I packed bone particles into every extraction site. In the event that he needs additional implants, he'll be in good shape. I'm not sure why, but I find suturing to be the most satisfying step of this procedure. Before I do bone grafting and suturing, I make sure to keep the field as clean as possible by squirting saline everywhere. I like to minimize the chance of future infections this way. Overall, Dr. Syed and I were happy with the way the new teeth came out. The 6 holes you see are where tiny screws go in to hold the teeth in place. In this case, we like where the axis holes, aka A-holes, come out. What am I exactly looking for? Let's say we divide the arch of teeth in 2 halves like this. I like to have the holes either right in the middle or slightly away from the front half. Why? This minimizes the chance of things breaking. We couldn't quite achieve perfect symmetry with teeth arrangement because the lower teeth are simply not perfectly aligned, but we were pleased nonetheless. In the cross-sectional views I'm showing you right here, we've got abundant bone surrounding each implant, so we expect these implants to last a long time. To learn more about the importance of thick facial bone, check out this video. Once the teeth were painted and ready to be inserted, we numb the patient and screw the teeth in. Check out the patient's bite right here. The upper and lower teeth come together like a lock and key, don't you think? Even though these cases can be quite physically and mentally taxing, I find it truly enjoyable, especially when our patients show a lot of appreciation for what we do. Here's a text message that I got from the patient 5 days after his surgery appointment, and text messages like this really keep us going. I've enjoyed doing this type of work since 2018, and I feel fortunate to be a member of North Texas Dental Surgery. We do these cases almost daily, and we've been fortunate to get a lot of support from patients from all over the country. We'll show you more cases in coming weeks, so stay tuned for more. If you haven't done so, please subscribe to our channel for more information about dental implants, surgical procedures, and dentistry in general. Also, please leave comments below if you have any questions.